Good afternoon, everyone, and welcome to the second town hall we've pulled together to discuss our county's response to COVID-19. My name is Chris Holman, and I'm the Portage County Executive, and I'm very happy that we have this opportunity to do a second, more focused town hall. This episode is very timely as it coincides with the surge in cases across the state, which in turn has presented our healthcare systems and public health departments with exceptional challenges. Health departments, hospitals, and healthcare professionals have been very clear and consistent with the message that people need to hear from the start of this crisis. But given that we're now seeing those same people issuing health alerts and making public appeals to follow recommendations and guidance that can help to slow this virus down and flatten the curve and otherwise put our communities into a much better situation than they are in now, those recommendations bear repeating. Please wear a mask or a face covering, and also maintain 6 feet of physical distance between yourself and anyone you do not live with. Wash your hands regularly. Just avoid all non-essential travel and activities, such as gatherings that may place you into higher risk situations. In order to facilitate today's conversation, we asked members of the public to send in their questions beforehand. Questions we receive that the panel doesn't have time to address will be answered and posted along with the recorded session. And now, let me thank the panelists for being here today. They are exceptionally busy, but their answers and information today will go a long way to informing our community further about all that is going on with COVID-19. Also, thank you to our moderator, Amy Eddy. Amy is a certified elder law attorney who works locally at Anderson O'Brien. And on behalf of all of us, I'd like to thank her for helping move the conversation along today. Also, thank you to Todd Kukan and to the Portage County Business Council for working with us to record these sessions and to get them out to the public. Thanks also to everyone who's taken the time to submit questions and to watch this session. And with that, I'll hand it over to you, Amy.
Thank you, Chris. I really appreciate the opportunity to be involved in these sessions. I know from our last session, it was pretty clear to everyone on the panel, and I think even members of the community, that a more focused session on a number of topics would be certainly appropriate and give a better opportunity to get more specific information. So before we hear presentations and start the questions, I'm going to go ahead and introduce the members of the panel and give a little wave as I do that so everybody can see, well, although I do think everybody's name is on their video. First, we have Portage County Health and Human Services Director Ray Przybelski. Thanks, Ray. Portage County Public Health Officer Gary Garske. Gary. Portage County Public Health Contact Tracer Brad Johnson. Thank you, Brad. We have Vice President of Aspirus Stevens Point Clinic, Bob Smith. Hi, Bob. We have Director of Student Health Services at UW Stevens Point, Dr. Helen Luce. Thank you, Helen. And Emergency Medicine Physician and EMS Medicine Physician at Ascension, Dr. Michael Clark. Hi, Michael. We're going to go ahead and have the panelists give us a presentation, some updates. I suspect that they will be also answering some of the questions that the community has sent in their presentations. To the extent that those aren't answered, we'll move right into the question and answer sessions after the presentations. We're going to go ahead and start with Health and Human Services Director Ray Przybelski, who will speak on behalf of himself and also on behalf of Gary Garske. Oh, Ray, you're muted. Ray, are you unmuted? There you go.
I got it.
There you
I got
go.
it. So thank you so much, Amy. What I said, all those grand things were lost because I was muted, I guess. So anyway, thank you so much for having us here today. Here at the Health and Human Services Department, we certainly are, you know, in the midst of responding to this pandemic. We are statutorily charged with, you know, the response to communicable disease, which of course COVID-19 is a communicable disease. Our role is heavily involved with our partners across the community, our healthcare systems, the universities, the schools, you know, a variety of different partners that we work together in order to try to contain and respond to the pandemic moving forward. Our primary role here is that we are charged with of contacting the positive cases after they've been notified from their medical provider and dealing with the positive cases on what it means to be in isolation, doing symptom monitoring with them, and putting a lot of that information into the WEDS, or the Wisconsin Electronic Disease Surveillance System. We are also charged with bringing on our contact tracers, and I know we're going to hear a lot from Dr. Johnson in his role as a contact tracer today. But our role there is to identify the close contacts with that positive case, contact them, and deal with their quarantine period moving forward. So we're looking to work with those close contacts, get the close contacts identified, as well as work with the positive case. Our other roles are around working with our community partners to assure that there is enough testing going on in our community. We have worked with the Wisconsin National Guard or brought in wing testing 5 times to our community. And as of this week, we are bringing in our community-based testing, which is a collaboration between our public health folks here, as well as our EMTs. And that's happening 2 days a week, on Tuesdays and Thursdays, from Tuesdays from 1 to 5 and Thursdays from 9 to 1 at the ADRC, or the Aging and Disability Resource Center, which is located on Water Street. So we look forward to continuing to working with one another as we continue to address the needs that this pandemic brings. Thank you.
Thank you, Ray. Next, we're going to hear from Bob Smith, Aspirus Stevens Point Clinic.
Yes, good evening. Thank you for having me, and appreciate the participation, opportunity to participate. Again, Bob Smith, Vice President of Stevens Point with Aspirus. Aspirus, as I indicated on the first town hall meeting, and I think most of the healthcare systems early on, it was about flattening that curve, right? So echoing Mr. Holman's recommendations, everything was about using social distancing, good hand washing, and wearing masks, etc. That is even more important now, as he expressed. So I can't express that any more than he did as well, and ask that the public really take heed of that notice and put into place those practices. But early on, it was about flattening that curve, educating ourselves, and setting up processes to manage this this pandemic and this disease that we didn't know a whole lot about. So we set up incident command. We quickly, as many heard, struggled with PPE early on, but our supply chain leadership was able to quickly acquire the required PPE, put us and our staff in a better place, and our patients in a better place with that equipment. We acquired lab testing equipment as quickly as we could and set up some in-house testing capabilities. We're trying to spread that capability to some of our other labs across our region. Put into play surge planning, and we had plans early on, as early as April and May. How are we going to manage a large influx of patients in our hospital and our facilities? And lo and behold, what are we experiencing today? So those plans, actually in the last couple of weeks, we've opened them up, and we are executing on those plans that we put into place a couple of months ago. And thankfully, we feel better than if we didn't have those plans. And I think we're better prepared with some of equipment, having the right staff do the right type of care delivery, etc. I know right now at some of our facilities, we're expanding our COVID units, setting up negative pressure rooms, ICUs that can manage the influx of patients that we're experiencing right now across our system. We're also looking at, as a system, ways in which we could continue to offer services for patients that don't have COVID. So how do we maintain separate lanes, if you will, of those of that care delivery with the COVID patients that we're trying to manage who are acutely ill, and then other patients that still need healthcare needs. So we've got processes by which we're able to manage both populations in an effective way.
Great, thank you, Bob. Next, can we hear from Brad Johnson, contact tracer?
So my role, or our role as contact tracers, I see, is kind of the boots on the ground, how do we corral this virus in the community so those who are testing positive actually are not going to spread it to their friends, family, and other community members. So that's our role. I think that one of the things that was asked to me was, what is it like to be called, and what should a patient or person expect if they get called from the health department? So typically, you're going to have your results from your physician before you hear from us, although occasionally that's not the case. Occasionally we're the first ones to tell you. But then what we're going to do is ask a number of questions, demographic stuff, make sure we're talking to the right person, their name, make sure we got it spelled right, your date of birth, address, things like that. And then we start asking about what type of symptoms you have, because we need to figure out how you're doing, for one, but also what your symptoms were, make sure it fits, and then when did your symptoms start, because that becomes very important when it comes to determining how long it will be that you have to be in isolation or quarantine. We talk a little bit about other risk factors that make you at higher risk for complications from COVID, and then we'll have a question or two about where you've been in the last couple of weeks, where you might have been exposed, or where you might have spread it. And then we get down to who have you been in close contact with during your infectious period. So typically we say your infectious period starts 2 days before your symptoms start and goes for at least 10 days after your symptoms start. So we ask about household members, work contacts, people in the community contacts you might have, and then we will contact some of those, and then we talk about what it is you need to do. What does it mean to be isolated? What does it mean to be quarantined, and things like that. So that's kind of our role is trying to corral this, and that's what you would hear from us as a contact tracer if you got called from us.
Great, that's very helpful. Okay, let's hear from Dr. Helen Luce.
Hello. So I'm the Director for Student Health on UWST's campus, and we've been doing a lot of things. I think our Chancellor, Bernie Patterson, was on the last town hall and talked about kind of all the preparation that we did, anticipating even back when we sent students home in March, starting to work on the plans for bringing students back in fall. So we had several months of preparation that we were able to put plans in place. Obviously, as everyone on this call knows, sometimes you have to kind of readjust once you have the real life situation. So as Director of Student Health, mostly what I'm focused on this fall is testing. We also have a screening tool that we are using. The students and employees who are on campus are supposed to complete an online daily screening for symptoms, and then they're directed to get testing if they have any symptoms. Testing, like I said, I'll talk a little bit about that because I think that's probably the area I know the best about. Then we've gone into a partnership now too with Portage County Public Health for contact tracing. So we have some UWSP employees who have been trained as contact tracers and are working hand in hand with our public health partners. And that's working well because they can have that connection to the campus and know kind of the students and some of the situations a little bit better than maybe some of the other folks in the community. We also have case management that's being done through our Dean of Students office so that they can reach out to the individual students who are in isolation or quarantine and quarantine, either one, to help them with any additional needs that they might have, whether it's academics or maybe technology needs while they're in our isolation and quarantine space. And then we do have isolation and quarantine space that we have made available on campus in a couple of the residence halls so that we can keep our students safe and separated from other students who have not been exposed yet. All the preventive measures that everyone already has talked about, we've put those in place on campus as well in terms of required face coverings and or any inside any buildings on campus, as well as outside if they can't maintain the 6 foot of distance. Lots of social media and marketing tools to try to help get these messages across about preventive practices, hand washing, hand hygiene, lots of hand sanitizing stations around campus, and a real big push to limit gatherings. College students like to socialize, as do I think there's a lot of publicity about college students and parties and things like that. And there's been a lot of push and work to try to get students to realize the kind of the dangers involved with doing that. And we've really seen some significant improvement with really a lot less of those parties off campus occurring, that at least that we've been made aware of. In terms of testing on campus, so like I said, that's kind of my area of expertise. We are doing antigen testing to screen our students who live in the residence halls. The antigen testing is nice because it's a point of care, so it's a rapid turnaround. We have results back in about 15 minutes. So we're doing that in our students that live in the residence halls about every 2 weeks. And we're starting to expand that to additional cohorts of students on campus who are in higher risk situations, like student teachers and athletes and things like that. Anyone who has a positive antigen test then is immediately directed to come to student health, and they get a PCR test. As you know, the PCR test is the definitive diagnostic test, so that's what we use to confirm a positive antigen test. After they have a PCR test done at student health, then they are, if they live on campus, they are sent to isolation to wait for their test results to come back. And then we make that contact, and the contact tracers take over after the students' results are back as well. Our PCR testing is done through a partnership with Marshfield Clinic, and our turnaround time on those has been 24 to 48 hours, pretty consistently right around 24 hours. So it's actually a really quick turnaround as well for our students, which is helpful. Our numbers, I just wanted to touch on that a little bit too. We do have a public dashboard if anyone is interested on the UWSP website that you can look at what our numbers are on an ongoing basis. We did have a spike back in kind of middle of September, which kind of corresponded to about a week after Labor Day, which was not surprising. But then consistently since then, we've seen a kind of a decreasing number to the point where last week we only had 14 positive student cases. So some nice improvement, at least on our campus, but obviously we're concerned and trying to be conscious neighbors of our greater Portage County and Stevens Point community as well, and trying to help reduce risk to our partners there. And that's all I have to share today. Thank you.
Thank you. And finally, let's hear from Dr. Michael Clark. Oh, you're muted, Dr. Clark.
I'm Dr. Michael Clark. I'm an emergency medicine physician at Ascension St. Michael's Hospital and some of the other hospitals in our system, and the EMS medical director for the Portage County EMS services, along with Spirit Medical Transport. So Ascension, is very similar to Aspirus, working on, how we can improve our ability to care for the patients in our community, focusing on patient, associate, and clinician safety, making sure we're having the appropriate protective equipment and protective practices in place, protect everyone involved in this, and also working on our both our internal surge capacity, and then also working with our partners on that kind of larger surge capacity within the region, and also improving our ability to perform testing. So to both protect patients and to improve our testing, we have a couple different methods people can get care and testing. We have remote testing sites, so some drive-up testing sites, so people don't need to be coming into the clinic, make it more convenient for them, also minimize their exposure to the non-COVID patients. Also having some dedicated respiratory clinics so that patients with respiratory symptoms can be seen at preferential locations or preferential times of the day. So patients who don't have a respiratory illness aren't potentially being exposed to those patients. Working on, obviously increasing our ability to care for the patient by increasing staffing, increasing our physical space, and also, working with our partners. We have regular meetings with both EMS, long-term care facilities, public health, along with regional meetings through our Health Emergency Response Coalition for the North Central Wisconsin. In fact, we're having daily meetings with all the healthcare organizations, so Aspirus, Marshall Clinic, and us. We're meeting every morning to kind of discuss where we're all sitting in terms of patients, elective surgeries, those types of things. If there's any unmet needs that might be unique to all three systems, so that we're all working together for the common goal of taking care of the community. Working to obviously continuously improve our testing. We both do testing in-house, then also partner being a statewide healthcare organization, partnering with our larger reference lab in the Milwaukee area to basically balance the testing both locally and throughout the states. So we're able to maximize the turnaround time for those time critical tests, but also maximize our capacity in terms of less ill patients that we definitely need to have that result, but maybe can we wait a little bit longer? We're able to send those down to the Milwaukee area so we can increase the volume of testing we're able to do while still maintaining that timeliness of turnaround for those critical more ill patients or patients needing procedures where that test result is going to change potentially the PPE or where someone's located. Also within our healthcare system, like everyone else, we're screening everyone who comes in, both patients and associates, enhanced disinfecting and cleaning, staggering our appointments so that we minimize overlap and reducing the amount of space in the waiting rooms so patients aren't potentially being exposed there. Looking at maximizing our PPE, being part of a national system, we're able to kind of balance out the PPE at the various locations. So we're able to maintain the PPE supply we need to care for the patients, while also instituting localized conservation methods so we make the PPE that we have last as long as possible. And just working to serve our local community and working with our regional partners so that we're all caring for the patient and providing the best care possible. Thank you.
Great, thank you. I'm actually going to start the questions while it's fresh with Dr. Clark. And Bob, I think you could chime in on this as well, related to kind of currently hospitalized metrics and probably the public health as well. So there's several questions related specifically to what's happening at St. Michael's Hospital. But I think it would benefit the public to know what's happening, not just there, but at other facilities. And then a lot of it relates to the metric of the currently hospitalized number of people. And so one of the questions is, why are we no longer reporting the currently hospitalized metric? Maybe public health can confirm, are we reporting that or not? If we're not, why aren't we? And then the hospital question relating to St. Michael's is asking why the public doesn't know what's really going on at St. Michael's Hospital, implying that that the COVID beds are full, that you're short-staffed, that the doctors are stretched thin, wondering why visitors are allowed. Can you speak to public health, first of all, about the metrics that we're reporting, and then just from the facility perspective, really what's happening with boots on the ground there? Is it everybody stretched thin and full, and doctors who are in contact with people are still working? What is the status of all that at facilities? I know that's a big question, but I think you know what I'm asking you to speak to.
Well, I'll let public health comment on the metric they're reporting, and then I can start speaking about the hospital standpoint, and then Bob can jump in there.
Thank you, Dr. Clark. So, this question has come up, quite often, I guess, in the last 2 or 3 weeks when we decided that we were no longer going to actually report currently hospitalized metrics as we were in the past. And there's a couple of reasons or a couple of factors behind that. Early in the pandemic, it was very easy for us to track, who was in the hospital, when they were getting out, when they got out, those type of things. As our numbers began to grow, certainly over the summer and now into the fall, it became really, really difficult to find out where every Portage County was at. We have a great relationship with our 3 local providers, with Marshfield Clinic, with Aspirus and Ascension. But there are people hospitalized in other hospital systems across Wisconsin. And what we found out is what we were reporting was actually not accurate data. And we decided we did not want inaccurate data going out there. So we took the data that we knew was accurate in WEDS, which was a cumulative number of people who have been hospitalized since the beginning of the pandemic, and the numbers that were new. And so that's the metric we are currently reporting out. So total ever hospitalized, which I believe today was up to 95, and then whatever was new since the day before, that's a very accurate number. We just simply want to give the public accurate data moving forward.
Thank you.
Thank you.
I mean, and I would say, from the hospital standpoint, I think it's important, for everyone to know exactly how many hospitalized patients we have who have COVID. That's a shifting number. We have patients who are, positive, who are under investigation because their test is a result. And that number, I don't think means as much. I think, as you can see in the media, we put out a joint position statement or joint press release with Aspirus and Marshall Clinic saying all of our hospitals are at or near capacity. I don't think that's a secret. We're all working very hard to care for the patients we have, and our capacity changes day to day. We're all relatively full. Some days we have a little more breathing room than other days because you might have some additional staff. We might have some staff who are returning for whatever reason. We're able to get additional staff trained into a role. So some days we might be able to care for a few more patients than another day, depending on our staffing levels. There is a metric the Wisconsin Hospital Association does publish on their dashboard the cumulative number of patients hospitalized throughout our region, which is really a more important number because if a patient comes into either one of our hospitals in Portage County and they need some advanced specialty care that we don't currently have at either of our hospitals here, they're being seen in Marshfield or at the Aspirus Hospital. Well, there's still a patient from our community. They're being hospitalized somewhere else. So the actual number we have here, I don't think is as important. All of our staff, they're working hard. And probably many people are working more than they typically would. But that's part of we're all responding to the pandemic. This is a statewide issue. I don't think any healthcare system right now is not being affected and operating near or at or even above their normal daily operating capacity. It's important to remember that on a day-to-day basis, we often have more physical beds than we have staff, just because there's a natural variation in patients. But now we're kind of working at or above that kind of average level we had previously. We're following the public health guidelines, and I think consistent across all of our systems that people who are symptomatic with COVID are not working. But if people had exposures, we're in a healthcare setting, we're wearing PPE, we're continuously being exposed. Yes, we may have an exposure on the outside, but we're wearing appropriate PPE to protect ourselves from infectious patients and also protecting ourselves if we for some reason would be an asymptomatic infected person. Our PPE also protects the patients from us. So I don't think there's any danger in coming to the hospital. There's plenty of disinfection. There's a full PPE being used by everyone. We have universal masking, so basically every staff member in the hospital is wearing a mask when they're within 6 feet of another person, and only taking off of their mask to really, eat and drink throughout the day to, maintain ourselves.
Great, thank you.
The other parts of that question I missed here?
No, I think that was great. Bob, did you have anything to add?
No, just to confirm Dr. Clark's statements. I think it's important to look at the regional numbers. This is a state issue. I had a meeting last Friday with other hospital leaders. Other hospitals across the state are dealing with high patient volumes and variable staffing ratios, as well as Dr. Clark outlined. And I think we're all struggling with that to a certain degree. We're going into virus season, right? And so as we get into the fall months, there's other viruses people are going to have. We're going to have absences, and patients are going to have other illnesses that they're going to come down with, not just COVID. So that's all going to put some pressure on us. But I'm, feeling positive, and I'm sure all the other healthcare systems here in our region, we've got plans and we've got processes that we're prepared to execute on to make sure that we're providing safe care to patients and keeping our staff and providers safe and effective in their care delivery.
I think it's important to remember, since this is a statewide issue, there, previously, if one hospital is overwhelmed, we could move patients around. This being a statewide issue, we're caring, statewide, we're caring for as many patients as we can. So yes, we may be caring for more patients per person than we typically have in the past, but that's because there's no one else to bring in to take care of that issue. We have to provide the care for the patients with the resources that we have, because the entire state and nation are being impacted by this.
Is there any thought of postponing elective procedures or other procedures to have more capacity?
Yes, our procedures are reviewed every day. There are still some procedures going on, but I think we learned previously that stopping all procedures isn't good, because then an elective, a quote unquote elective case now becomes a non-elective case, because we've waited an additional weeks or months to get those patients in. So, we're doing it day by day. If things can be, pushed off, if we can delay something for another month or two, we'll try to do that. But many of the cases we still need to perform that, because if we don't perform it today, It's now going to become a more urgent issue, say 2 or 3 weeks from now. And this we're in this for the long term. COVID is going to be an issue we're going to be dealing with for weeks to months. So we have to basically continue to make sure the rest of the healthcare system remains operational. So we're caring for the non-COVID patients in addition to the COVID patients.
There was also some questions specific to Aspirus. Why does it take so long for Aspirus to get test results back? I'm just wondering, in general, at any facilities, can you speak to testing and kind of the average time and what impacts the length of time that it takes to get a test back, you know, this week versus last month, or at any particular facility?
Yeah, I can start off in answering that specific to Aspirus, but I think other health systems are dealing with this as well. We're on allocation, so we only get so many test kits or test medium to perform some of these tests. And so we have to prioritize what tests we're going to do. So I think Dr. Clark spoke to this earlier. There are patient types that need to have a 24-hour turnaround. Any patient that's admitted to the hospital with symptoms, patients that need surgery, whether that's emergent or elective, patients that are going in a nursing home, or even healthcare workers, police officers, teachers. Any of those individuals are essential tests that we're turning around in a 24-hour period. So as more of that volume comes, the other lower prioritized patients that need testing, we are sending out to some outside labs, which have a 3 to 5 day turnaround on some of those tests. But we're working as diligently as we can to turn those around and get those results back to the patients as soon as possible.
So the more hospitalizations, the more surgical people, emergent people are going to go to the head of the line. And the more of those we have, the more that's going to push that testing off.
Yep, that's correct. That's what we're experiencing right now.
Okay. I'd like to talk a little bit about contact tracing. So Gary, Ray, Brad, certainly. As an employer, I think about these questions as well and what to tell my employees who have a person at home that is exposed to someone who was positive. And also someone who is living with someone who is positive, what those isolation periods are. So people get confused why someone who is positive is to isolate for 10 days and their household close contacts have to quarantine for 14 days and how all of that works. Can you expand on those timelines?
I'll take a shot at that one. So what we say is for someone who is positive for COVID, they have a minimum of 10 days for isolation. And then at the end of that 10 days, they have to be without fever, without a productive cough, and generally feeling better. If they're not, that it gets extended another 10 days. For those people who are close contacts or household contacts to a positive case, they have 14 days from their last contact, because we know that the virus has an incubation period, 3 to 5 days. It can be in your system before you develop symptoms. So if you're exposed to a person who's got COVID, it takes those 4 days to maybe get symptoms and then another 10 days to be over it. Now, some people get sick, but obviously some people have no symptoms at all. 30 to 40% of the people who have COVID don't have any symptoms at all. So we have to do that at 14 days for the close contacts to account for the incubation period of the virus in your body.
So then what happens if your last contact with the person that you were exposed to was you wait your 14 days, but what if you live with that person? So what happens then?
Right. So if you live with that person, and you can isolate the positive person within the house, and that means separate bedroom, separate bathroom, and someone can cook for them, bring the meal to the door of the room they're staying in, set it down, walk away, and then the person who's positive comes out and gets it. Then it's 14 days from the time you start that. But there are a lot of people who can't isolate it within their home from each other like that. So then the close contacts 14-day quarantine period starts after the 10 days of isolation for the positive case. So it could be up to 3 weeks of being home and not going out and staying quarantined.
Ray, do you have anything to add, or Gary? That makes a lot of sense to me anyway.
No, I think Brad really covered that quite well. I know that that's frustrating for people, you know, when they find out saying, I'm going to be in quarantine for 21 to possibly 28 days, and the person that was sick was only 10. But again, as Brad has talked about, you know, there is that incubation period. Plus, we have to take into consideration when's the last time you actually had contact with that person, that they could be spreading the virus to you if you can't isolate within your own home.
And the other thing that I think has changed a little bit over time and has gone back and forth a little bit is, when should you be tested? Some of the questions that came in were, if I have symptoms, and I called in and I was told I didn't qualify to be tested. So what qualifies people to be tested these days?
Well, I think a number of us could answer that question here, but I'll take the first stab at it here. So certainly one of the big concerns that we have is that you have the viral load. So if somebody says, I've been exposed to somebody who is positive, I want to go get tested. I was exposed today, I want to get tested tomorrow. You know, they certainly, we believe that they would not have a viral load that could be measured during that test. So as I believe either it was Dr. Clark or maybe it was Bob that talked about it, you know, we're looking at that 3 to 5 day window period in order to assure that you have a viral load. You know, that we're trying to stay consistent with that. I think there's a lot of frustration around the fact of, you know, if I develop symptoms, I'm told to go get tested. Again, that you know, that is true. You should get tested if you have symptoms, if you know you've been exposed, or even if you just develop those symptoms. But we're looking at something that we want to assure that you have the viral load that can be measured in order so we can catch you. So you're not going to get tested and then come back negative, and then 3 days later feel worse and you have to get tested again.
And then on the other side of that, there's a question about people who test positive but return to work or come out of isolation within 2 or 3 days of that positive test, which I would imagine could happen based on your last contact and the length of the time that it takes to get your test.
So let me take a shot at that. I think that, you know, remember the 10 days of isolation for a positive case starts the day you get ill. So if you wait a week to get tested and now it takes you 3 days to get your test result back, you're at 10 days. So
right.
Now that means you've exposed a lot of people in the meantime. So there are going to be a lot of contacts or maybe contacts to track down, but it's that 10 days that starts when the symptoms start.
Great. I think we're at 4:42 and we just have about 3 minutes. So I want to talk just a little bit about testing. Ray, you mentioned that there's going to be community testing. I'm hoping you can speak a little bit more about that and how that works. And then a lot of the questions that have come in, I'm kind of summarizing and combining these because we don't have time to answer them all, and just to let everybody know that these will be available for answers. So the answers will come, but for purposes of today, I want to summarize. A lot of the questions have to do with where we should be doing regular testing. Should that be in schools? Should it be in employers, large employers that have a lot of employees that are in close contact? Are there any testing sites for employees that might be coming about in the future? And the community testing, how does that work and how is that going to work going forward?
So our community testing started actually yesterday. That was our first day. This is in conjunction with our local EMTs that are actually doing the testing and our public health staff. So we are hoping to perform 300 tests a week in that testing site at the Aging and Disability Resource Center. It is just like the wing testing. It is drive-through testing. No appointment is required. We can accept people who walk up as well because we have some people who won't drive in our community. So that will be every Tuesday and Thursday, as I said before. Our hope is that, you know, we are just going to add to the amount of testing that's available. We are also working with the state to see if we could possibly bring on another day of wing testing, 1 day per week. We're just trying to establish that what day that would be if we indeed get that day. And that would be for an additional 300 tests. And it would be at the same site. So really, we're just trying to broaden the amount of testing that is available here in our community. I think that, you know, we are also working very closely with our EMTs, you know, to basically develop strike teams, and those strike teams would be available to go into a particular business if we identified an outbreak, or possibly a school or something like that, that they could go in and do some testing on site for those individuals. I think that, you know, when outbreaks have been identified, certain businesses, if you want to look at like long-term care facilities, nursing home, they're required to have a certain amount of testing per week, whether it's once a week or twice a week for staff and residents. So strike teams can help out with that. If there was an outbreak, as I said, if there was an outbreak in schools, we were hoping that we could use that strike team to go out and test in schools as well. So lots more testing happening as we move forward here into the fall. And we're just going to try to, again, aid our community health partners with the amount of testing that they're doing as well.
And with regard to that community testing, how does that get processed, in what kind of a time frame? And are people called with a negative or a positive? There was a question saying, why don't I get a call if a test is negative? I'm wondering if does that happen? Do people get called one way or the other?
Yes, absolutely. They will get called. You know, the time frame that we're working off to is right now 3 to 5 days in order to receive results. We are running our results through Exact Sciences, which is the exact company that is doing the wing testing as well. So they will get notified, but Exact Sciences will only attempt to contact them by 3 times. If they don't reach contact, then they're gonna get a hold of us to say, hey, we can't reach X number of people and they're negative. Then we'll be notified of the positives as well, and we'll be reaching out to try to let those people know that are positive.
Great. Thank you so much, Ray, and thank you so much, everyone. These are really great answers. And I see it is 4:46, so I'm going to ask Chris to unmute himself and give us any closing remarks.
Okay, so thank you very much again to Amy and to the panel. You've all provided us with a lot of information and insight. I hope that we can all take that information and employ the knowledge in our day-to-day lives, as well as share it with other people in our circles. You hear this a lot these days, and it's true now, and it's going to remain true for a while, in that COVID-19 really is a challenge for the entire community. And the collective success of our efforts hinges on the actions of individuals and keeping those simple and straightforward measures in mind as we go about our lives. So again, please wear a mask, socially distance, wash your hands regularly, or use hand sanitizer. Keep your circles small, avoid high-risk situations, and just be safe. And as a reminder, you can find the latest COVID-19 information, daily press releases and updates, and much more on the Portage County website, which is at co.portage.wi.us. There's a banner at the top of the page. It'll bring you to the COVID-19 page, but also keep an eye on in the spotlight section, which is at the bottom of the homepage, as we always put big news and updates there when it comes out. If you have further questions, please send them in to the CountyExecutive, all one word, at co.portage.wi.us email, or definitely give us a call at 715-346-1997, and we'll get back to you as soon as we can. So thanks again, everybody. Thanks to the panel. Thanks to the Business Council, and have a good evening.